Hey everybody, Donnie Gardner here with the Boston Terrier Society. In today's episode, I have a special guest. She is the founder of Hound Canine Massage. Her name's Heidi, and she specializes in giving dogs massages. And I would have never thought about this as an option for Bella. She actually has arthritis and hip issues. So it could be very beneficial for your Boston Terrier or just any dog that you might have, especially if they're elderly. So I hope you enjoy this. She talks about a lot of great benefits. Some things really surprised me, so enjoy. Thanks. Perfect. So yeah, Heidi, if you could just tell me a little bit about your company, what you do, and kind of how it got started.
Okay. Well, my name is Heidi Hesse, and my company is called Hound Canine Massage, and I am a nationally certified canine massage therapist. So how I got started in all of this, I had my last dog, I have Old English sheepdogs, had a back injury, and I took her in for acupuncture, I took her in for chiropractic, and one of my friends suggested massage. So I went to the other woman in the Twin Cities, I live in Minneapolis, by the way, who is nationally certified, and I would say maybe after 3 or 4 sessions, I really started to notice a difference with my dog where she didn't hesitate going up steps as much. She seemed to have a little bit more of a spring in her step. And I was just actually really, really impressed with the results. So I thought, I have to look into this and find out, how I can do more about this and what I can do. So I did some research, and there's I would say a handful of schools around the country that teach canine massage. I went to the Chicago School of Canine Massage for 2 reasons. Number one, its proximity to me because I had to travel to go to school there, and number two, it was very hands-on, and I don't think you can learn massage online. So
right.
You really kind of a lot of people do. So I wanted to go somewhere where I could actually have somebody show me what was hands-on massage. So I did, their level 1 and level 2 classes and finished both of those. And then I studied for the national exam, which is a really long 5-hour test that's pretty comprehensive and pretty intense. Mm-hmm. And now, not a lot of people do it, but I think it adds a little legitimacy to the profession. So I am now one of the 2 people in the Minneapolis St. Paul area that's nationally certified.
Wow. But before this and everything, did you have any background training dogs, or was this just kind of you saw what worked for your dog and it kind of inspired you?
Yes and yes. In my other life, I am a sound engineer. So hence the name Hound Canine Massage. Mm-hmm. For the past 20 some odd years, I have had, my dogs have all been therapy dogs. So we visit at hospitals and libraries and things like that. And I was one of their tester observers. So the people who would evaluate new dogs and their owners and teams to see if they would be, a good fit for therapy work. So, and I know it's trite to say, but I've had a dog ever since I was 2, and they've always been part of the family. So I've just always, animals have always been a huge part of my life.
Right. Yeah. So as far as sound engineer, I don't know what that is. What is that exactly?
A sound engineer. Well, I have, for the past 20 plus years, worked with a couple of different cameramen, and we do, it's a film and video. We work for a lot of
literally. Okay. Yes.
Yeah. We work for news magazine shows, NBC is one of my big clients. I have a quick little shoot for CNN next week, that kind of thing.
Mm-hmm. Okay.
So totally unrelated from canine massage.
Yeah, but still something that you're passionate about.
It's a pretty good job most days. I mean, I just don't want to have to carry heavy equipment till I'm 65. So
right.
Canine massage is kind of a nice, spending time with dogs is a little bit easier than carrying heavy equipment. So
right. So as far as the canine massage, what is a typical client? Is this a healthy dog or a dog you're trying to rehabilitate? For you personally, as far as your client goes?
I would say, well, as far as my clientele right now, I would say, let's see, maybe about 65% of them are elderly. It's like the dogs start maybe at around, depending on the size of the dog, maybe at around 10 years of age, they start slowing down and owners start trying to figure out different ways that they can help their dog and keep them, comfortable and mobile into their golden years. I would say, I always have like a lot of dogs. I mean, the most prevalent surgery that we deal with is ACL surgery, or it's actually CCL in dogs, the cranial cruciate ligament surgery. So I work out a couple days a month. I work out of a veterinary clinic in town, and they have a rehab department and all that, and I help with the massage portion of it.
Okay.
And helping getting them back, because if you can get a dog with an injury, or have had surgery and start doing massage right away, one of my clients, she recovered so well you would not have known she had surgeries, which is so wonderful.
Right.
I also have some dogs that have some kind of stress. They're like high anxiety dogs, and they don't know how to calm down. I've had a few that are touch reactive. They're, a lot of it, you spend a lot of time building trust and getting them to trust you to actually let you touch them.
I didn't think of it helping for anxiety. Would that be fair to say?
That is very fair to say. I mean, there's a lot of benefits of massage, and I would say reducing stress and anxiety is a huge one. I mean, but it also, it helps with joint and muscle pain. It boosts the immune system, and it improves like flexibility in your circulation. I mean, it's great for like canine athletes. I have a couple of those as well, as in hunting dogs and agility dogs. Because it's like an athlete. They're really pushing it. So they come in for recovery massage. So it pretty much, I think it helps, provide comfort in any stage of life. I mean, I end up with a lot of, sometimes I'm one of the people that, a lot of dogs come to when they're towards the end, and their owners just want them to provide any kind of comfort they possibly can.
Okay.
So, which I'm incredibly honored that they, allow me to be part of such a very significant event. So.
Right. Yeah. As far as like, I'm trying to think. As far as anybody getting a dog massage, would you recommend this to anybody, or is it kind of just that elderly?
No, I think anybody can benefit. I mean, I've had a service dog who's a regular client, and he's only 3 years old, but they kind of want to do it as like a little bit of a treat, and they also want just to keep him in the best condition that he can possibly be in, just so he can stay with them longer. I mean, I think I love working with my old dogs. They are like the sweetest, most grateful dogs in the world. But if you can start a little sooner, the sooner you start, the longer the benefits are going to last for you. I mean, if I would have known that, I would have started with my dog right after her back injury, and I ended up waiting a few years, and that's because sometimes I had a client who had a shoulder injury, and there was so much scar tissue up by the time she came to me. It was a lot of work to even get things moving a little bit.
Yeah.
So, I mean, years of scar tissue is hard to move. So.
Yeah. My Boston, she has, it's only whenever it's cold out, but she'll get just stiff joints. And I bet that would definitely help.
Oh, very much so.
As far as an age, go ahead.
No, go. I mean, as far as an age, I would say, well, I mean, any time is fine, but it depends on, for elderly dogs, I mean, how should I say this? Younger dogs live longer and they don't have as much weight on them. So, starting a little later is probably not the worst thing in the world. But, it really does depend on what you're going for. Some dogs have, I have a tripod dog who is, a little 3-legged dog who's in great shape. But once a month, her parents get her a massage just because they want to, because she's compensating with other muscles for her missing limb. So, and those really get worked twice as hard as they were supposed to. So she's doing great. She's in good shape, but, once a month she gets her little massage just to kind of keep her in a great shape.
Yeah. How often should dogs, well, whenever you take on a client, are the, for a person, they recommend like no more than 3 a week as far as a massage. Mm-hmm. Is that kind of the same guidelines, or?
Well, when you first start, massage for dogs is such a different experience. I mean, dogs are used to being touched, but not the way that a massage therapist touches them. So I recommend usually when you first start out to at least do it once a week until the dog starts to get comfortable, or depending on what you're seeing the dog for, until you start to see some results. And then you can start tapering off and, maybe every week and a half, maybe 2 weeks. I have one dog right now who had CCL surgery, and I see her every 3 weeks, and she seems to be doing great. I have one client, he's a 15-year-old little schnauzer, mini schnauzer, and I see him every week. So it depends on, what kind of stuff they have going on and the age of the dog and I guess the financial resources of the owners and, whatever you can provide your dog.
Yeah. As far as, like packages and whatnot that you offer, is it a monthly subscription, or, because I know like my wife, she does Massage Envy, and that's a monthly subscription on the human side.
Right. I have packages where it's pretty much it's a massage package where you pay for 4 massages and the 5th one is free.
Okay.
So, so there's at least a little financial incentive to continue on, and it makes it a little bit easier on, the person who's paying for it to actually have that. And I will say, the first time I see a dog, it's called an initial consult and full body massage. So it usually lasts for about 60 to 75 minutes because we do a complete medical intake and discuss what our goals are for the massage. And it's, you want to know everything you need to know about that dog. I mean, are they on medications? Have they had surgeries? It's everything you can that could kind of answer questions about what we need to do to help this dog feel better.
As far as I know, elderly dogs you see, agility type dogs. What's the normal? I guess what's the most dog that you've seen as far as dog type in your practice?
As far as dogs, in my practice, I would say elderly dogs. I mean, I will say dogs with arthritis, and most of the time they're elderly dogs. I mean, some of the dogs that have arthritis are dogs who have had an injury and now they have arthritis. But yeah, I would say dogs with arthritis who are by and large the oldsters.
Is there a particular dog breed that you've come across?
That has more issues than others, you mean?
Yeah.
Or wow. Each breed is totally individualized, because like a lot of the smaller breeds, like a Boston Terrier, they might have issues with luxating patellas, and a lot of the larger dogs, like your golden retrievers or German shepherds, have hip issues, and each breed has its kind of, or a longer dog, say a Basset Hound or a Dachshund, a lot of times have back issues. So yeah, every breed is different, and and if it's a mixed breed, you're never even sure on that one. You just have to wait and see what's going to come out.
Right. So as far as like Bostons in particular, I know you've handled a few Bostons. Is there anything maybe you could say to the listeners to look out for as far as something that might steer them to going to get a massage?
So something to look out for to encourage a massage? Is that what you mean? Okay, let's see. I'm trying to remember back to my little Boston was named Pearl that I most recently saw. Well, she actually had like some sort of nerve damage in her back. So that's not across the board with other Bostons. So, I mean, with little dogs, I mean, it's especially, that they have a lot of energy and they can get hurt a lot easier because they're smaller and more fragile. And they're not as dense of a body. So there's that. I'm not sure about, I mean, a lot of smaller dogs have luxating patellas, which is your little kneecap can slide in and out of place, which can be an issue.
Right.
Depending on their gait and their posture, some of them, their front legs kind of slightly rotate out. And if that's the case, then the muscles are getting used differently. So that's something that, you could kind of focus on the muscles of the front if they're actually I mean, that's very typical in that kind of breed, is to actually have that sort of a stance. So, but it's depending on how far it rotates out, it could be something to be concerned about. Okay. So, yeah, it depends on your dog's you always want to look out for your dog's activity level. Have you noticed that something's changed recently? I mean, and also anytime, if any of this ever happens, I would say, number one, go to your vet and get some sort of a general idea. I mean, I've had a few people who have called me first before they call the vet. And when I get there, I look at them and say, you need to go to the vet first. And then when you come back, then we'll work together, because, I can't diagnose. I can help in recovery, and I can help you feel better. But there's, and I have, I can suspect things, but I don't have any veterinary training.
Mm-hmm. Would you say before anyone should book an appointment with you to go see their vet first, or?
I would say it depends on the reason you're thinking of booking an appointment. I mean, if it's an elderly dog, you probably already know that it has arthritis.
Right.
If it's a dog that's got stress and anxiety and really high anxiety issues, you already know that. Mm-hmm. I mean, but if you suspect there's some other underlying condition, I would definitely say go to the vet first to find out, what's going on. I mean, and even if it is a dog that might just have arthritis, it's good to know. Like, a lot of times I will get a client and they said, well, yeah, we're pretty sure he has arthritis. And I'll say, well, where do you think the arthritis is? Well, in his back legs. It's like, well, are we talking hips? Are we talking knees? It's always nice to have the guidance of a vet. I mean, I love it. I actually work with the woman who's in charge of integrative medicine at the University of Minnesota. Is an acupuncturist, and one of my clients, she'll always send notes back. She goes, well, today when I saw Bodhi, I noticed this and this, so if maybe you can work on that and that. So it's really nice to have guidance, because she's going to notice things that I probably won't notice, in her exams. So I try to work with vets as much as I possibly can in that respect, because it's really nice to know. And like a rehab vet technicians as well. Okay. I get sent a lot of people through the vet technicians that I know.
As far as, so we kind of talked about the benefits and everything. Are there any negatives?
I wouldn't necessarily call it negatives. I would say there's definitely contraindications, times that you just should not do massage. Mm-hmm. And those are, I think, fairly obvious. Like if there's any open sores, or if they have like acute inflammation, like, redness and swelling. Like if there's any broken bones or an infectious disease.
Right.
I would say like diarrhea is always, there's something going on. So you might not want to be dealing, you don't want to be moving stuff around if there's diarrhea, and it could, make matters worse. Mm-hmm. So, and I will say some dogs it's pretty rare, but there are some dogs that just are not going to let you do the massage. And, that's not a negative. That's just the dog. I mean, I had a dog where they would put a muzzle on him when I would show up because he was recovering from surgery. And eventually I wasn't able to touch the dog, but I pretty much taught the owners what to do as best I could so they could do it, because the dog would allow the owner to touch them. Yeah. But it's fun. I mean, I would say most dogs, you might lay right down in your lap in the very first session and you're able to do whatever you need. Other dogs might take 3 or 4, 5 sessions to actually really get comfortable with the whole concept of massage. I had one little dog who she was a Beagle Bulldog mix, and I've been seeing her for, she's like super high energy. She would come into the room and she'd run and run and run and run, and she would not calm down. And now she comes into the room, she lay down on the mat, she rolls over onto her side, and she waits, and I play some music for her, and she falls asleep within 5 minutes of coming to the room, because she's done it so long that she knows this is her time, and she relaxes and she gets her massage. So, which is wonderful.
That's awesome. As far as, so you teaching people, sometimes that happens. I saw that you have group classes on your website. Is that what those group classes are all about?
Pretty much some different organizations. I mean, I've taught like a service dog organization and a few therapy dogs organizations. I did and different breed groups like Newfoundland. They have me come in and I do a little talk, and then we pretty much do, I teach them some really basic stuff that they can do at home to kind of just keep their dog, feeling good and giving them a little treat at the end of the day. So, and it's anything that, it's a lot of it's pretty basic. I mean, I don't want them, trying to, release trigger points or anything like that, but some nice basic massage techniques that it's kind of like, if you have a sore neck and somebody offers to give you a neck massage and they're not a professional massage therapist, it still feels good and it still helps. It might not be, as wonderful as a massage therapist, but it's still, I think every little bit helps.
So as far as people that, don't live in the Twin Cities, do you have any resources like videos or something like that to share with people, or is it pretty much your local?
Well, I personally, I actually was thinking of, strange that you'd say that. I was actually talking to my cameraman friend the other day of maybe starting to do a few little videos, that I could put on my website or on Facebook or, Instagram or something like that. Just, saying, demonstrating one really simple technique for the day or something. It's really tough because there's a lot of them out there, and some of them are really good, and some of them really are not.
Right.
So I would say there's it's NBCAM. It's NBCAMM. It's the National Board of Certification for Animal Acupressure and Massage. That's the national organization that I am nationally certified through.
Okay.
And I mean, if people are looking for massage therapists, they have you can go on there and they have a list of all the nationally certified folks that are, and that they have it listed by state.
Okay.
So that's a really great starting point for finding, somebody that I know has probably, if they had to take the tests that I had to take, they really know their stuff.
Okay. And that's pretty much the same thing as far as referral business, I guess. If somebody's looking for someone, just go to that national organization.
I think that would be a great starting point. It depends on where you are in the country. A lot of veterinarians might not have, they might be able to refer you to somebody or at least have heard of somebody. I mean, it's kind of surprising. I would say there's probably maybe a half a dozen folks in the Twin City metro area that really, really know what they're doing. That I would be, if I can't take you on as a client because I'm too busy, I would feel very comfortable referring to. And I think bigger cities are going to have better luck. Smaller cities, it might be a little bit harder. You might have to travel. Most of the massage that I do in-home massage because it's a strange enough process as it is. So I want the dog to be in a place that he's the most comfortable.
Right. Yeah.
So I go to people's homes, but I do also work out of a vet clinic a couple days a month, and I work out of a doggy daycare a couple days a month, just kind of covering all the bases to try and get as much massage out there as we possibly can.
Right. Well, once you make those videos, let me know, and I'll put it in the show notes.
Great. Well, I just got this fancy new iPhone, so that might be sooner than later. So you never know.
Well, anything else that you'd want to share before we kind of wrap up here?
Boy, I would just say give it a try. I mean, massage is the one thing I have found is a lot of people are still kind of hesitant about because most people don't do massages for themselves. So why would they do it for their dogs? So a lot of times when, I tell people I'm a canine massage therapist, they say, "Oh, really? Well," and I'll say, "Well, what's that all about?" And I'll say, "Well, have you ever had a massage?" And they say, "No." And you go, "Okay, so we're literally starting from ground zero." And you have to explain the benefits and why you would want to do that. So, yeah, I mean, I would just say keep an open mind and explore whatever you possibly can to help your dog for whatever their needs are. And if massage is part of that, fantastic. There's a million other options out there, and everything from cold laser to acupuncture to chiropractic. But I would say at least keep an open mind and try massage, and try it, a couple of times to see if it might be something that would really benefit your dog.
Right. It sounds like you need to do it a couple times actually to get the full
exactly
your dog calm and in the
exactly.
right
I mean, it depends on the dog. 'Cause I've got a golden retriever who pretty much the first time I met him draped himself on me, and I couldn't get him off my lap. So some dogs are totally great with it, and other dogs it takes a little bit of time.
Well, as far as people reaching out to you and contacting you, what would be the best way for them to do that?
Well, you can check out my website, which is www.soundhoundmassage.com, and there's an link to click on that. You can send me an email through that. Okay. I also am on Facebook, and I'm also on Instagram.
Okay, and I'll put all those links in the show notes, of course.
Super.
All right. Well, thanks again for taking the time to do this and everything.
Well, I hope I gave you all the information that you need.
Thank you for listening to today's episode. If you want to get more videos or podcast sessions like this, be sure to click the subscribe button, and I look forward to seeing you guys again. Thanks. Bye.